We're going to be covering Chapter 8, Joints, and breaking it apart into two parts, Part A and Part B. Why this matters. Understanding the nature of joints will help you treat patients with injuries such as ankle sprains.
Now that you've learned about the many bones that make up the human skeleton, let's focus on the structures that hold these bones together and enable them to move, joints, which also may be referred to as articulations. The elbow, wrist, ankle, and knee are all examples of joints. As a healthcare professional, it's very important for you to understand the structure and function of joints so that you can properly evaluate and treat patients with common joint injuries, such as sprains to the ankle or knee. It's essential that you know how joints move and the attachments they form with ligaments and muscles throughout the body so that you can assist your patients. For example, in an ankle sprain, the ligaments reinforcing the joint are stretched or torn. Partially torn ligaments will repair themselves in time, so treatment may simply involve immobilizing the ankle so the body can do its work, undisturbed by movement. In more severe cases, where the ligaments are fully torn, surgery may be necessary to repair or replace the injured ligaments. Having a thorough understanding of the structure and function of joints will enable you to properly assess and treat your patients with joint injuries.
Classification of joints. Joints are also called articulations. They are the sites where two bones come together and meet. The joints function to give mobility to the skeleton and to hold the skeleton together. We have two classifications of joints, structural classifications and functional classifications. Structural classifications are three types based on the material that binds the joints together and whether a cavity is present. And those are the fibrous joints, the cartilaginous joints, and the synovial joints. The functional classifications, there are also three types, but these are based on the movement the joint allows. Those three are synarthrosis, which are immovable joints, ampiarthrosis, which are slightly movable joints, and diarthrosis, which are freely movable joints. Structural classifications are more clear-cut, so these will be the classifications that we use here. Let's begin with the fibrous joints. Bones are joined together by dense fibrous connective tissue in fibrous joints. There is no joint cavity, and this is the most immovable type of joint. The mobility will depend on the length of the connective tissue fibers. Longer fibers allow for more movement, shorter fibers, less movement. The three types of fibrous joints are the sutures, the syndesmosis, and the gomphosis. Let's take a look at those. Sutures. These are rigid interlocking joints of the skull. They allow for growth during youth, and they contain very short connective tissue fibers. These allow for expansion during growth. In middle age, the sutures will ossify and come together almost as a fusion. These immovable joints will join the skull into one unit that protects the brain. These closed, immovable sutures that we find in adults are referred to as synostosis. Here we have a picture of the fibrous joint, the sutures of the skull. These types of joints are found only in the skull. They're held together with very short interconnecting fibers, and the bony edges interlock. Syndesmosis are bones that connect by ligaments, fibrous bands of tissue. The fiber length varies, so movement varies. Short fibers offer little to no movement. An example of that would be the inferior tibiofibular joint. The longer fibers offer a larger amount of movement. An example would be the interosseous membranes that connect the radius and the ulna. Here we have an example of the syndesmosis. The joint is held together by the ligament. The fibrous tissue can vary in length, but is longer than we would find in the sutures. Gomphosis is a peg and socket joint. The only example that we have are the teeth in the alveolar sockets. The fibrous connection is the periodontal ligament, and it holds the tooth in the socket. Here we have our peg and socket gomphosis fibrous joint. The periodontal ligament holds this tooth in the socket. Cartilaginous joints are bones that are united by cartilage. Like fibrous joints, they have no joint activity. They are not highly movable, and we have two types of cartilaginous joints, synchondrosis and symphysis. Synchondrosis, we have the bar or the plate of the hyaline cartilage that unite the bones. Almost all are synchondrotic and movable. Examples of a synchondrosis would be the temporary epiphyseal plates, which act as joints, and they become synostosis after the plate closes. The cartilage of the first rib with the manubrium of the sternum is another example. Here we have pictures of our two examples, the epiphyseal plate, which is temporary, and the joint between the first rib and the sternum, which is also immovable. Symphysis is a fibrocartilage joint that unites the bone in the symphysis joint. The hyaline cartilage is also present as articular cartilage on bony surfaces. Symphysis are strong, amphiarthrotic, meaning slightly movable joints. Examples of our symphysis would be our intervertebral joints and our pubic symphysis. And here we have those examples. Here we have the body of the vertebrae and the fibrocartilaginous intervertebral joint, disc, sandwiched between the hyaline cartilage. Second example is the pubic symphysis, uniting the two pubic bones. Synovial joints are bones that are separated by fluid-filled joint cavities. All of the synovial joints are diarthrotic, meaning they are freely movable, and they include almost all the joints of the limbs. Characteristics of the synovial joints are they have 6 general features. They have bursa and tendon sheaths associated with them. The stability is influenced by a number of factors. They allow several types of movements, and they're classified into 6 different types. Synovial joints have 6 general features. The first feature of a synovial joint is that they all contain articular cartilage. The articular cartilage consists of hyaline cartilage that covers the ends of the bones. This prevents crushing of the bone ends. Secondly, they have joint or synovial cavities, small fluid-filled potential space that is unique to synovial joints. 3. Articular joint capsule, 2 layers thick. The external fibrous layer consists of dense irregular connective tissue, and the inner synovial membrane consists of loose connective tissue, and that membrane makes synovial fluid. Number 4, synovial fluid. This is a viscous, slippery filtrate of plasma and hyaluronic acid. The synovial fluid acts to lubricate and nourish the articular cartilage. It also contains phagocytic cells that move to remove microbes and debris from the joint cavity. Number 5, there are different types of reinforcing ligaments. Capsular ligaments are a thickened part of the fibrous layer. Extracapsular ligaments are outside the capsule. And intracapsular ligaments we find deep to the capsule, covered by the synovial membrane. And number 6, they have nerves and blood vessels. Nerves detect pain and also monitor joint position and stretch. The capillary beds supply filtrate for the synovial fluid. Here's the general structure of joints. So here we have the ligaments on the outside of the joint. Within the joint, we have the joint cavity that contains the synovial fluid. On the ends of the bones coming into the joint, we have articular cartilage, also known as hyaline cartilage. We have our articular capsule, which consists of the fibrous layer and the synovial membrane that secretes synovial fluid. Other features of some synovial joints include fatty pads, and this is for cushioning between the fibrous layer of the capsule and the synovial membrane or the bone. Also, you may find articular discs, also called menisci. These are fibrocartilage that separate the articular surfaces to improve the fit of the bone ends. Also, it will stabilize the joint and reduce the wear and tear to the bones. Bursa and tendon sheaths are bags of synovial fluid that act as lubricating ball bearings. They're not strictly part of the synovial joints, but they are closely associated with them. Bursa reduce the friction where ligaments, muscles, skin, tendons, or bones will rub together. They're small fluid-filled sacs. The tendon sheaths are elongated bursa that wrap completely around the tendons, and they are also subjected to friction. Here we can see a picture of this. We have a frontal section through the right shoulder joint. And to orient you, this is the humeral head and neck. Here we have the acromion process of the scapula and the joint, the glenoid fossa or the glenoid cavity here. Here we have a bursa inferior to the acromion process, so we call it the sub, meaning beneath, the acromial, subacromial bursa. Here we have a tendon sheath that is wrapped around the tendon of the long head of the biceps brachii muscle. Here we also have synovial membrane. And of course the joint cavity, which contains synovial fluid. Here's a closer look of this bursa, this fluid-filled sac that decreases the friction where a ligament or other structure would rub against the bone, causing damage. And the bursa will roll and lessen the friction. We have 3 factors that determine the stability of the joints to prevent dislocations. The first is the shape of the articular surface, and this serves as a minor role. Shallow surfaces are less stable than deep ball and socket surfaces. The second factor is ligament number and location, which also has a limited role. The more ligaments, the stronger the joint. The ligaments hold the joint together. And then the third factor influencing the stability of the synovial joints would be muscle tone. The muscle tone keeps the tendons taut as they cross the joint, which is rather important. This is extremely important in reinforcing the shoulder and the knee joints and the arches of the foot. Okay, this table comes directly from your book, and it describes the structure and functional characteristics of the body joints. We'll begin at the top. The joints of the skull are the articulating bones are the cranial and the facial bones. The structural type in the skull are the fibrous joints, which are sutures. And the functional movements allowed are synarthrotic, meaning there's no movement. As we move further down, we have the temporomandibular joint, and that includes the temporal bone of the skull and the mandible. This is a synovial joint that is a modified hinge joint. It also contains an articular disc. The functional type is that it is diarthrotic, gliding, and uniaxial rotation. You also have slight lateral movement, elevation, depression, protraction, and retraction of the mandible. The atlanto-occipital joint, which is between the atlas and the occiput, is a synovial joint, a condylar joint. This is a diarthrotic biaxial joint. Flexion, extension, lateral flexion, and circumduction of the head on the neck are the movements. The atlanto-axial joints, which is between C1 and C2, between the atlas and the axis, is a synovial pivot joint. This is a diarthrotic, uniaxial joint which allows for rotation of the head. The intervertebral joints between adjacent vertebrae are cartilaginous joints, symphysis joints with the disc in between. They are ampiarthrotic and slightly movement. On the posterior aspect of the spine, we have our intervertebral joints. These are between the articular processes. These are synovial joints, plane joints. The movement is diarthrotic, specifically gliding. The costovertebral joints are the joints that occur between the vertebrae and the ribs. These are synovial joints, also considered plane joints, diarthrotic, gliding of the ribs against the vertebrae, transverse processes, and the bodies. The sternoclavicular joint is the joint that occurs between the sternum and the clavicle. This is a synovial joint. It's a shallow saddle and it contains an articular disc. This is a diarthrotic, multi-axial. It allows the clavicle to move in all axes. The sternocostal joint, the first sternocostal joint, is the sternum and the rib one. This is a cartilaginous synchondrosis. The synarthrotic, which means there's no movement. The sternocostal joints between the sternum and ribs 2 through 7 are synovial joints, double plane joints, and these are diarthrotic, gliding joints. Moving out to the appendicular skeleton, we have our acromioclavicular joint. This is the joint between the acromion process of the scapula and the clavicle. This is a synovial joint, a plane joint. It contains an articular disc. The functional movements allowed are it's diarthrotic. It allows for gliding and rotation of the scapula on the clavicle. The shoulder joint, also known as the glenohumeral joint, occurs between the scapula and the humerus. This is a synovial joint, a ball and socket joint. The movement, it's a Being a diarthrotic, it allows for multi-axial flexion, extension, abduction, adduction, circumduction, and rotation of the humerus. The elbow joint consists of the ulna and radius with the humerus. It is a synovial hinge joint. Functionally, it's diarthrotic, uniaxial, allowing for flexion and extension of the forearm. The proximal radioulnar joint is the joint between the radius and the ulna proximally. It is a synovial pivot joint. Functionally, it is diarthrotic, uniaxial. It allows for pivot. Convex head of the radius rotates in the radial notch of the ulna, allowing for supination and pronation. The distal radioulnar joint, also occurring between the radius and ulna, but distally, is a synovial joint. It's a pivot joint, and it contains an articular disc. Functionally, it is diarthrotic, uniaxial. It rotates the radius along the long axis of the forearm to allow for supination and pronation. As we move distally to the wrist, we have the radius as it articulates with the proximal carpals. This is a synovial joint, a condylar joint. Functionally, it is considered diarthrotic, biaxial, and allows for movements of flexion, extension, abduction, adduction, and circumduction of the hand. The intercarpal joints, further distal, occur between the adjacent carpals. This is a synovial joint, a plane joint, and it allows for gliding movement. It is a diarthrotic functional joint. The carpometacarpal of digit 1, or the thumb, is the joint between the carpal trapezium and the metacarpal one. This is a synovial joint or saddle joint, and functionally it is considered diarthrotic, biaxial, and has movements including flexion, extension, abduction, adduction, circumduction, and opposition of metacarpal 1. Carpometacarpal joint of digits 2 through 5. These consist of the carpals and the metacarpals coming together along a synovial joint, a plane joint, and functionally considered diarthrotic, gliding of the metacarpals across each other. The metacarpophalangeal joints, also known as the knuckles, make up the bones from the metacarpals and the proximal phalanx. These are synovial joints, condylar joints. Functionally, they are diarthrotic, biaxial, and allow for movement, flexion, extension, abduction, adduction, and circumduction of the fingers. The interphalangeal joints of the fingers. These joints occur between adjacent phalanges. They are synovial hinge joints. They are diarthrotic, uniaxial, and allow for flexion and extension of the fingers. This next table continues with the joints in the lower extremity. We'll begin with the sacroiliac joint, which is a joint that is created with the articulating sacrum and coxal bone. Structurally, these are synovial joints, plain in childhood, and they become increasingly fibrous as we age. Functionally, they are diarthrotic in children and become ampiarthrotic in adults. There is more movement during pregnancy due to the hormones. The pubic symphysis consists of the two pubic bones. These are cartilaginous joints that come together via a symphysis. Functionally, they are ampiarthrotic with slight movement which again is enhanced during pregnancy. The hip joint or the coxal joint is made up of the bones, the hip bone and the femur. Structurally, they are synovial joints, ball and socket joints. Functionally, they are diarthrotic, multiaxial, allowing for flexion, extension, abduction, adduction, rotation, and circumduction of the thigh. The knee is the tibiofemoral joint, and it consists of the femur and the tibia articulating. Structurally, this is a synovial joint. It's a modified hinge joint, and it contains an articular disc. Functionally, it is diarthrotic, biaxial. Movements include flexion, extension of the leg, some rotation, which is allowed when the knee is in the flexed position only. The knee also has the articulation between the femur and the patella, named the femoropatellar joint. This is a synovial joint, a plane joint. Functionally, it is considered diarthrotic, gliding of the patella along the femur. Moving distally, we have the superior tibiofibular joint. It's the articulation between the tibia and the fibula proximally. It is a synovial joint, a plane joint. Functionally, it is considered diarthrotic, and the movement is the gliding of the fibula. Distally, we have the inferior tibiofibular joint, consisting of the tibia and the fibula at the distal end. This is a fibrous joint or a syndesmosis. Functionally, it is considered synarthrotic, slight give during dorsiflexion of the ankle. Moving proximally, we have the ankle joint, which consists of the bones tibia and fibula with the talus. This is considered a synovial joint, a hinge joint. Functionally, it is diarthrotic, uniaxial, and it allows for dorsiflexion and plantar flexion of the foot. The intertarsal joint consists of the adjacent tarsal bones. They are considered synovial joints, plane joints. The movement includes diarthrotic, gliding, inversion, and eversion of the foot. The tarsometatarsal joint consists of the bones tarsals, metatarsals, and also the metatarsal and proximal phalanges. These are synovial joints, also known as condylar joints. Functionally, they are diarthrotic, biaxial. Movements include flexion, extension, abduction, adduction, circumduction of the great toe. And then lastly, we have our interphalangeal joints. These joints comprise of the bones from adjacent articulating phalanges. This joint is a synovial hinge joint. Functionally, it is diarthrotic, uniaxial, and the movements include flexion and extension of the toes. Movements that are allowed by synovial joints. All muscles attach to bone or connective tissue with no fewer than 2 points. Those points are called the origin and the insertion. The origin is the attachment to the bone that is not being moved, and the insertion is the attachment to the bone that is being moved. Muscle contraction causes the insertion to move towards the origin. Movements occur along the transverse, frontal, or sagittal planes. The range of motion allowed by synovial joints. Non-axial means slipping movements only. Uniaxial are movements in one plane. Biaxial are movements in two planes. And multiaxial are movements in or around all three planes. The three general types of movements are gliding, angular, and rotation. Gliding movements is when one flat bone surface glides or slips over another surface. Examples would be the intercarpal joints, the intertarsal joints, or the articular processes of the vertebrae. This is a gliding joint, and the carpals are gliding along each other in order to make the movement of adduction and abduction. Angular movements increase or decrease the angle between the two bones, and this occurs movement along the sagittal plane. The angular movements will include movements like flexion, which decreases the angle of the joint, extension, which increases the angle of the joint, and hyperextension, which is movement beyond the anatomical position in the extension. Okay, so here we have moving the head forward is flexion. Just having the head upright is extension, and putting the head back is hyperextension. Again, for the trunk, forward bending is flexion, standing upright is extension, and back bending is hyperextension. The shoulder joint, the first picture is the shoulder joint, and the knee joint. Flexion of the shoulder is moving the arm forward. Flexion of the knee is bending at the knee, and the foot comes back. Extension of the arm is having it down. Extension of the knee is straightening the leg, and hyperextension would be bringing the arm back from that plane. We do not have hyperextension of the knee. Some other movements include abduction. This is movement along the frontal plane away from the midline. Adduction, which is movement along the frontal plane toward the midline. And circumduction, which involves a combination of movements: flexion, abduction, extension, and adduction of the limb. The limb describes the cone in space. So here we have abduction coming out from the body, adduction moving in, and circumduction, which is the combination of many of the movements. Rotation is turning of the bone around its own long axis, toward midline or away from midline. Medial rotation is rotation towards midline. Lateral rotation is away from midline. Some examples are rotation between C1 and C2, or rotation of the humerus and the femur. So let's take a look at those. Here's rotation of the cervical spine. Shaking your head, no. Lateral rotation of the leg would be turning your foot out. Medial rotation would be turning your foot in, and the movement occurs at the hip joint. We do have some special movements that occur in specific areas throughout the body. Supination and pronation is rotation of the radius and ulna exclusively. In supination, the palm faces anteriorly. The radius and the ulna are parallel in supination. Pronation, the palm faces posteriorly, and the radius rotates over the ulna. Special movements of the foot are dorsiflexion and plantar flexion. Dorsiflexion is bending the foot towards the shin, and plantar flexion is pointing the toes or standing up on your toes. Here we have pronation and supination. Prone, palm back, supination, palm forward. Dorsiflexion, toes up, plantar flexion, toes down. Some other special movements occur at the foot: inversion and eversion. In inversion, the sole of the foot faces medially, and eversion, the sole of the foot faces laterally. Protraction and retraction are movements that occur in the lateral plane. We see this in the mandible, where protraction, the mandible juts out, and retraction, the mandible is pulled back towards the neck. So let's take a look at this picture. This is a picture of inversion and eversion at the ankle, and protraction of the mandible, sticking the mandible out, and retraction, pulling it back in. Elevation and depression of the mandible. Elevation means lifting a part of the body superiorly. We see that with the mandible. We also see it when you shrug your shoulders. It's elevation of the scapula. Depression is lowering the part of your body. So lowering the shoulders or opening the jaw would all be depression. Opposition occurs with the movement of the thumb. An example is when you touch your thumb to the tips of the other fingers on the same hand, or in a grasping movement. Here we have elevation of the mandible and depression of the mandible. Opposition of the thumb. This table describes all of the movements of synovial joints: gliding, flexion, extension, abduction, adduction, circumduction, medial and lateral rotation. There are 6 different types of synovial joints, and the categories are based on the shape of the articular surface, as well as the movement that the joint is capable of. These categories are plane, hinge, pivot, condylar, saddle, and ball and socket. The 6 types of synovial joint shapes determine the movements that occur at a joint. A plane joint has flat articular surfaces. The intercarpal joints, the intertarsal joints, and joints between the vertebrae articular surfaces are considered plane joints. These are non-axial movements, and it is gliding. The hinge joint, examples being the elbow joint and the interphalangeal joints, are allow for uniaxial movement, flexion, and extension. The pivot joint, which is also uniaxial movement of rotation only, occurs between the ulna and the radius. We will also see this type of joint in the atlantoaxial joint between C1 and C2. A condylar joint allows for biaxial movement. These are oval articular surfaces, and they allow for flexion, extension, adduction, and abduction. We find condylar joints in the metacarpal phalangeal or knuckle joints, and also in the wrist joints. The saddle joint allows for biaxial movement, adduction, abduction, flexion, extension. The articular surfaces of this type of joint are both concave and convex. An example of a saddle joint is the carpometacarpal joints of the thumbs. The ball and socket joint are allow for multi-axial movement, flexion and extension, adduction and abduction, and also rotation. We find ball and socket joints in the shoulder and in the hip joints.